You are live.
So it's Senate Education Committee, March 14th. We're back after a short break. Switching gears to, I guess the topic is the state of Vermont's children, 2024 year in review. And we have with us today, Wilton Crossman, Executive Director of Building Right Futures. And so, and we have, by the way, a lot of materials that have been provided for us that got seats for us. And so the floor is yours. So do you know, you don't know everybody, do you?
I don't necessarily know everyone.
So we'll start with introductions around. In the chair there, assume should be coming in, is Senator Ron Hemsdale from Chittenden.
I'm not a machine, Wyndham County.
Dave Weeks, Rutland County from Proctor.
So Juan Garcia, Bennington Senate District.
Terry Williams, Rutland County from Polkney.
Steve Heffernan, the Addison County District. Bristol.
And you are?
I'm Dr. Morgan Crossman. I'm the Executive Director of Building Great Futures, which is Vermont's Early Childhood State Advisory Council. What that means is I am your primary advisor on kids and families prenatal to age 8. I'm joined by Martha Braithwaite, who is in our room to help share the Zoom screen today. My daughter Amelie is not with us, thankfully. She is at school, and I found someone to pick her up. So
I want to start by acknowledging that you made the trip here yesterday as well for this from Heinsberg.
Yeah.
Jill, my sister, Mrs. Ross.
I didn't.
She went down there.
Okay.
But that by the time we could have gotten to you, at least I said I'm right dead, and you probably want to have my brain if we're going to go through this. So I'm feeling much like brain dead today. So off we go.
Perfect. Friday at 2:00 is better than Thursday at, but we'll go with that. So here's just a quick background. I'm an 8th generation Vermonter. I am from Rutland. My entire family still lives in Rutland, and I just moved back in the last 6 years in this position because I wanted to raise my daughter here. So she is a 7-year-old fierce little gymnast that goes to Heinsberg Community School. She has received special education and high quality early childhood education across the system. So just giving you some of that background that not only am I in this hat as the executive director, I am actively living early childhood and the system of services for kids and families. And Martha, you can go to that next slide. In terms of what I want to cover with all of you today, just a high level overview of what our role is in the system, because I don't spend as much time in Senate Education. I spent quite a bit of time in Senate Health and Welfare, so I do know some of your colleagues already. But talk a little bit about the snapshot of the indicators that you need to know about on behalf of kids and families, and then really talk about pre-K.
Right.
Sure.
How was Vermont's Early Childhood State Advisory Council formed?
Oh, it's a perfect question.
Yeah.
Okay, so it was actually through executive order. So there was a conversation about whether or not the governor and the administration should be able to hold the vision for kids and families for the state across so many different agencies, departments, and districts. So Building Great Futures and the state advisory was created under both the Federal Head Start Act and Act 104 and then Title 33, Chapter 46. So we're named in both state and federal statutes as being responsible for holding the early childhood strategic plan, monitoring the system of services, elevating the voice of families and communities, and essentially being that primary advisor to say to all of you, what data do you need to know in order to inform how you want to move something? And it's not just on childcare or education, it's actually across the entire early childhood sector.
And it existed for
the last 11 years, 12 years.
Okay.
So how did you get listed with the federal?
It's under the Federal Head Start Act. So there are state advisory councils across the country who have a similar mandate or charge. They are all structured differently. In Vermont, there's a much stronger component of how we are supporting the legislature in particular, being that primary advisor and making sure you have data. In some other states, it's actually got rulemaking authority or served specifically for just childcare and early childhood education. But in Vermont, we are much more broad to say, okay, we're talking about basic needs, health, mental health, nutrition, anything that touches kids and families across every single sector.
Interview a line item.
And my last slide for you talks about that line item. Oh, yeah, you can see it. I know. Yes. So just to give you a little bit more background on the organization, we again have that state and federal statute. We advise you all as the legislature. We also advise the governor and the administration, as well as our federal delegation. We are considered a nonpartisan quasi-governmental entity. It's really interesting. Mark, I'm going to have you go to the next slide. I'm going to actually have you go one more, and then we'll come back to this. When I say a quasi-governmental organization, half of my board is the administration. It is all of the agencies, departments, and divisions that support children and families in the state of Vermont. There are also 2 legislative seats. So the Senate and the House both have representation on the board. Those 2 representatives are actually charged with bringing the legislature's perspective on key issues and to be that liaison back to you all. We also have non-voting members from the governor's office and other agencies and departments. But then we also have half of the board as at-large members, meaning those are different entities who are supporting children and families across all different sectors and 2 family members. So
Appointed by the governor.
yes, so it's a 23 governor appointed board in terms of membership. So in terms of the funding question that you asked, we're publicly and privately and federally funded. Right now, 75% of our budget is federally funded, and you serve as a pass-through for quite a bit of money that also goes out the door to support communities, and I'll talk a little bit about that later. Any questions about the board makeup? Okay, great. So Mark, if you can go back to slide 3 just quickly. All of our work is based on children and families. So hopefully what you'll hear from me is here's where we are right now, and here's the broader vision, and what questions and data do you need to have answered to inform something like overhauling the entire education system for the state of Vermont? What do you need to know about the youngest and most vulnerable kids and families? So what you're seeing on the left-hand side is, again, all of our work is focused on 0 to age 8 or prenatal to age 8. Our job for you all is to bring evidence and data to inform decision-making. Sometimes that evidence and data is a number. Sometimes it's the experience of insert whatever group you need information on. If you're tackling special education, if you're tackling early childhood and family mental health in education, coming to us and saying, what do you have on this? What do we know right now? And how do we help make decisions based on that? One of the questions you asked is whether or not we're in state and federal statute. So we have that state advisory council, which is in that middle bar. There's so many other levels of the work that we have. We have 12 regional councils across the state of Vermont that is also legislatively mandated to say, okay, how do we know what's happening and what the needs of children and families are on the ground? So we bring together providers, educators, pediatricians, anyone who's working with kids and families alongside families themselves to say on a monthly basis, where are we? What is a regional response? What are the issues? And they will come together to problem solve. When they can't solve that problem, we actually elevate that to the administration to see if they are able to problem solve, as well as our full board that you saw earlier. So continuous identification of what those needs and challenges are for kids and families. We also have 7 strategic plan committees. You see the word VCAP, that is the Vermont Early Childhood Action Plan. So again, we hold that in the state of Vermont. We have public and private partners come together on a monthly basis to say, okay, we've set a tone and a vision, where are we? And do some of that problem solving. The interagency coordinating team is all of the agency leaders that are on the State Advisory Council. We separately bring them together to say, okay, how do we know whether or not we've actually coordinated our system of services? How do we support integration? We've now heard these are the core needs in this moment. How are we responding and adapting? That group also is the entity that comes together for kind of senior decision making on behalf of kids and families on a monthly basis within the administration. And then you all hold the policymaker seat. So you are at the top of the pyramid. Our job is to give all of the information that we hear from every level to you all to say, okay, what do you need and how can we support your understanding? Martha, can you go 2 slides for me now? Thank you. All right, this is my fierce 7-year-old Amelie helping me write a federal grant. She's much bigger than that now, but I promised I would show a picture to all of you. So again, one of our key roles for you all is monitoring the system. How do we understand the needs of kids and families? And that advisory role means that we're serving as a nonpartisan independent broker of data. So similar to the role that the Joint Fiscal Office plays for you all, that's a similar way that we support the legislature in understanding needs of kids and families, experiences, child outcomes, but also making that data publicly available. I'm not going to talk to you about all of the different ways that we do that work, but there's so many different components. Instead, what I would say is more important for you to hear is I am not a lobbyist or an advocacy organization. My job is to come in and say, how do I connect you to data, the people, or the resources you need to help make decisions? So you won't hear me come in and say, I oppose this, or I would like you to move in this direction on anything. It's tell me what data you need if you are trying to improve a system for kids and families. And it's really about how you understand whether or not the laws, the programs, and the things that you're putting in place are actually aligned with the broader vision for the system. And is it making a difference? All right, next slide, Martha. Because a lot of these policy recommendations that are on the slide right now are not as specific to education, I won't go through all of them, but I want you to be aware that on an annual basis, that network that I talked about comes together and votes and endorses a series of policy recommendations that go both to the governor's office and to the legislature. It's printed in that report. And I'll talk a little bit more about the ones for pre-K, because I feel like those are the most relevant to this committee. But some of those are about ensuring family and community voice are in place. We absolutely had recommendations on housing and what that means for young kids and families. We have recommendations that might be about data systems or the lack of data systems and infrastructure in place across the board. And something that I know this committee cares a lot about is how we're ensuring the social, emotional development and health of children when they're in our education system. So how do we meet the social, emotional health and the developmental needs, especially when we're seeing a rise in behavior challenges and mental health conditions for our young kids. Next slide, Martha. Just to make sure that you know where to go to find information if you don't see me in the building. We have a data and policy center through Building Bright Futures website. There's so much data that you can access. So data from this report, additional data and indicators that are organized by topic area. So if you go in and type in mental health or education, you can find indicators based on what the most available data is. You can absolutely also call, email myself or members of my team, but just so that you know, that is where you can find some of that information. All right. Next slide. One of the roles that I didn't talk about that we play in the system that is one of the really important things that informs our work is the relationship with families. So we're also required to have and serve as this key liaison between families and decision makers. So when you all have a question, in particular in the last 3 years, I can think of questions that the legislature has said, can you please go out and find from families what their experience with universal pre-K is? Can you please tell us what their experience is with childcare and accessing insert any number of services? One of the key roles we play is going out and finding that information. We also have a series of ways that we capture that information on a monthly basis, but also on an annual basis. So we have daily needs assessments and data collection. But there's so much work that's happened in this area, and elevating family and community voice has been such an important factor because sometimes the number can't tell you the whole story. All right, slide 9, please. It's really small, so I don't expect that you're able to see this, but this is also published in the report for you, and you have the slides. One of the ways I talked about the regional councils that we have across the state, what you're seeing on this slide is if we ask all of the partners within that region to tell us what the top 2 priorities are in the moment on behalf of kids and families and what they are struggling with, this is what we see on that map. You're seeing a lot of child and family mental health. You're seeing a lot of access to basic needs, building resilience in children and families. And and the quality and capacity of early childhood education services. So one of the reasons that this map is really helpful and important is we see there is a lot of traction in the same topics, but there's also regional variation, right? So something that might work in Chittenden might not work in Bennington, might work in Rutland, but not, right? So this is really important to understand. There are different needs, and sometimes regions are able to address them, and sometimes they need to elevate those priorities up to say, actually, we have a huge issue in housing, and how are we building that strategy? All right, next slide. One of the things I didn't name for you all in our statutory charge is that we are also responsible for bringing money into the state of Vermont or helping other organizations raise funds to support kids and families. So the slide here, again, really hard to see, is it's a range of all of the grants that we have made out to communities who are doing incredible work on behalf of kids and families. So again, within those 12 regional councils, we have priorities and we are able to respond to emerging needs. But we also have something that's called the Vermont Early Childhood Fund. So we administer right now more than $2.6 million in grants, largely from the federal government. So again, we are writing grants to bring money into the state to meet gaps that the state can't fill. So right now we've distributed funding to over 42 organizations across the state in a range of different needs. So on the slide, what you're seeing is about 13 different early childhood education programs receiving funding to preserve slots. You're seeing access to child sexual abuse prevention education. We have 5 different programs that are expanding access to developmental assessments. So again, as we're thinking about the growing number of kids who have disabilities and social health care needs, how are we making sure we're able to find them early so they can get access to the services and support that they need?
So that rolls up to you from the regional councils.
Yep, so our regional councils and the state.
So these are, okay.
Yep, so we
Put
take,
two together.
we put the two together, everything that we know on behalf of kids and families from all of the data, the needs assessments and the regions.
Yep.
And we say, okay, what are those priorities? We then write those into some of our federal grants and say, okay, the state has gaps here, and then the federal funding is helping us to fill some of those.
So who sets the state priorities? The governor, the legislature, staff?
So the state priorities are developed as part of the strategic plan process. Every 5 years, I'm giving one of these years right now. Every 5 years, we update the early childhood strategic plan. There's a year and a half worth of information gathering from all of the sources, right? The needs of communities, what the legislature is prioritizing, what the administration is prioritizing. And so the last time that was updated was 2020. And we're currently analyzing all of the data that we have for the last 5 years to say, okay, where are we in relationship to the vision we've set for kids and families? And then we'll update that strategic plan in this next year. So it's actually a collective process.
So it's a look back at the last 5 years, how you did, but it's a look forward to the next 5 years.
Exactly.
But again, how do you prioritize? How do you figure out what's most important, where to apply for treasure?
So one of the things that we've been working on right now is that continuous identification of needs. One of the things that we've seen is a lot of those needs haven't changed. They've been stable. We are seeing emerging needs, and we've seen things that, for example, weren't in the strategic plan from 2020. So some of the big picture things that we see consistently: workforce, mental health, access to high quality services, right? Substance use disorder wasn't in that strategic plan. That is coming up as a high priority. Housing and homelessness was not as called out in that strategic plan. So there's a series of both community conversations, data analysis, and then collaborative meetings where there's decision-making processes that are in place. So the legislature is a part of that. The entire state advisory council and the advisory board for that project are a part of that.
So it's part of the process to figure out what programs work, what programs don't work,
It
and
is.
where we'll, okay.
And a part of the preschool development grant is that as well. So we have, one of the things that I have seen having come back to the state of Vermont in the last 6 years is we've done some incredible work. We've been really innovative on behalf of kids and families. What we haven't done well is evaluate the impact of the system of services and evaluate programs to know what's working and what's not. So that is a part of the process. And that means a lot of hard conversations and negotiation over the next year about what lands in that vision and strategy for the next 5 years.
So remember from health and welfare, we see
Yeah.
a lot of Let's Grow Kids.
Yes.
What's it, do you work with them? What are the comparisons?
Great question. So Let's Grow Kids is an advocacy organization. Their mission and their work is solely focused on high quality, affordable childcare. So they will come in and provide you with information and testimony and advocacy on how you should move specifically in terms of childcare. They're a partner of ours. They absolutely support our work in childcare. And as we think about early childhood education more broadly, our organization does not advocate and is responsible for a much broader scope. So not just childcare, but childcare, mental health, early childhood education, special
Do
education.
you compete for any of the same funds?
That's such an interesting question. I would say they are, just like we are, a nonprofit in the state of Vermont. So again, we were strategically created outside of state government. We do share a lot of funding sources. They are transitioning in this next year out of their current role in the system. So as we see them transition out of that space, a lot of the work, especially around data and policy, will be a part of Building Great Futures work going forward, but not the advocacy side of that work. But I would say we are working to be more collaborative with building the capacity of nonprofits, especially in this funding climate. And so a part of our charge in statute is to help bring in additional funding to support that work. Okay.
When we do our Rutland County field trip, we should go see the Reggio Inspired Professional Development. We did the same Reggio Amelia Inspired Professional Development work with the city of Burlington and our local preschools. It's amazing.
So
are
I
you
don't know what that
visiting?
means.
So you have to go, right?
Yeah.
So I'm from Rutland.
Yay!
So
Okay.
I was talking with them about going home this weekend, but I think that that's great. And when you do go, I'd love to come.
Yeah, I just made that up, but I would like to go. Like, I think we have a field trip in the works. I'm excited. Yeah.
But I think what I want you to see in this map, right, is that part of our work is making sure that we're also supporting other organizations working on behalf of kids and families, because our board is so diverse and it's not just one sector. All right, Martha, you can go to the next slide. All right, so I'm going to give you just one slide on State of Vermont's children, which is the highlights of everything in that book. So we did a virtual briefing on this. I also made sure you have those slides. If you want to do a deeper dive, that is definitely where to go for that information. But I wanted to start out, especially hearing the senator's question yesterday. What are some of the bright spots for kids and families right now? What should we be really proud of? The first is that as a state, we've increased our enrollment in childcare financial assistance so significantly in ways that is both leading families to have access and having that access be more affordable. And we're leading the country in prioritizing that effort. Are there still challenges? Yes, but we are absolutely leading the country in this area. And one of the other roles that I've been able to play is serving on national panels to talk about some of this work, to make sure that we're actually elevating some of the amazing things that are in Vermont. Specific to this committee as well, we're leading the country in access to universal pre-K for 3 and 4-year-olds. So again, as you're thinking about making changes in different pieces of the system, be really aware of where we're doing really well and not breaking those pieces as we're trying to adapt to meet other needs. So again, in terms of equitable access, we have 10 hours a week of universal pre-K. For 35 weeks a year for both 3, 4s, and 5-year-olds not yet eligible for kindergarten. And we are leading the country in that area. Again, so much to work on, but we're doing really well in terms of access. This is a new indicator that I love to share, which is that when we look at how our young kids are doing, specifically our 4-year-old children, we're actually seeing them meet or exceed expectations in math and social emotional development. That's a really important indicator because of some of the others that I'm going to talk about in just a minute when we're transitioning into K-12, right? So now if you go down to some of the things that we are actively monitoring and would say are really high priorities. So to your question of what will end in this strategic plan, there's no way you will not see things related to childcare and housing and mental health and, early childhood education. But in terms of some of the things that are really challenging, we've seen such a striking increase in the number of children who are homeless, unhoused. And I will say, one of the anecdotes that I will share is that I did receive several calls from Rutland. I went and spent a day and volunteered at one of the hotel motel programs for the day and did case management with families. I met with over 25 families who were being unhoused that day. And it was a really powerful experience to understand the reality of what it means to not have a safe place to bring your young child. And the majority of the families that I worked with in that moment had children with significant special health care needs, right? There were some on nebulizers that wouldn't be able to plug them in. There were significant, behavior challenges. There were at least 3 children with autism spectrum disorder. There was a lot going on. And it was a really helpful, powerful thing to have a region and the partners that are coming together within regions call and say, we need someone from the state, come down to see. And then can you please elevate this? We then brought it to the State Advisory Council. It landed in our policy recommendations that we needed urgent action in a range of areas. And we've seen progress. And I know you're all still grappling with how to handle that, but we are seeing a significant number of young kids, and specifically seeing, 4 infants that were about to go out in a pack and play into the woods when it was 30 degrees. So again, there are real babies and real humans associated with some of these policy decisions. A part of my job is to make sure that you have that information. One of the other challenges that we're seeing, and I think is really important for this committee to hear, is that we're seeing so many more children with social, emotional, mental health conditions. We're seeing them show up not ready to learn in our schools, right? They're coming in really struggling. And then we are also having early childhood educators who are struggling and school systems who are struggling. And so, as we're thinking about that rise and that increase alongside school budget challenges, what does that mean? How are we thinking about supporting our schools and early childhood educators and our paraprofessionals and the support staff? One of the things that I would name for you, especially because one of my other indicators is 3rd grade math and reading, is that another very real example is that in Heinsberg Community School, they have para professionals and extra support staff who are there to help young kids. Only those who receive IDEA services, meaning they have an individual, under the Individuals with Disabilities Education Act, right? They have an IEP. My child does not have an IEP anymore, but she's still struggling in math and reading after a series of challenges with speech and language during COVID. So she's receiving extra support right now because they have it available. Those positions go away in the next couple of years. So again, as we're seeing challenges financially and we're seeing challenges in workforce, we're seeing our kids struggle in a range of areas. So how do we balance that? And what are the different ways that we can be thinking about that? Not as necessarily relevant for this committee, but we're seeing our young moms struggle, right? So we're seeing higher rates of perinatal mood and anxiety disorders. The indicator that I just mentioned to you around 3rd grade math and reading, we are seeing really low rates across the board in 3rd grade math and reading, but absolutely rates that are much lower for our historically marginalized children. So we're seeing a really big disparity, and that data is highlighted in this report. So again, in thinking about who has access to what and when and under what conditions, this type of data is really important to be thinking about. And I just want to call your attention back to our 4-year-olds. They're doing really well as we're thinking about high quality early childhood education, right? So we're seeing our 4-year-olds exceed expectations in social emotional development and math. And by the time we're seeing, and this is not a longitudinal study, it's not the same child, but we're seeing a difference once our kids are getting to that 3rd grade math and reading. So what does that mean about what we need to be thinking about in our education system? The last indicator I'm going to talk about, which is not going to be news to all of you, is that we have antiquated data systems that don't allow us to actually track some of these things, right? So right now, we can't tell you necessarily the total number of children in the total number of programs by public and private and what that looks like over time. Those are really important, but also very basic things that we as a state should be able to count. And because our data systems can't talk to each other, a lot of what happens is you ask the Agency of Education for data and you ask the Child Development Division for data, their data systems don't talk, and then there's so much work that has to happen just to land on the total number of children across public and private programs to answer very basic questions. So just naming that data systems are a big need and a part of the role that my organization plays that I wish you didn't have to is coordinating all of that data. So everything that you have in front of you is because there are over 40 different data stores across the state of Vermont, both in agencies, but also on the ground, who are elevating data to us, and we are summarizing it and synthesizing it versus having systems that can talk to each other.
And I'm just, I'm really glad you put perinatal mood and anxiety disorders on there as a fellow mom, because one of the most consistent correlations, across so many studies is that mom's mental health is the greatest indicator of kids' mental health. And in a way, I can actually see how it's a good thing to have identified mood disorders and postpartum, things like postpartum depression and anxiety, more fully understood, the prevalence of them to be sort of highlighted, because most moms don't realize they have that. And to make it so standard to be asked differently, like my mom says, wow, it's like they asked, but they didn't really care about the answer. Now I feel like they care about the answer. And how much can change if you help moms earlier, because it's very correctable. It's just very, for most folks, you can really pivot health-wise, mental health-wise. And I think it's been the education committees that have done things like ACEs, just the kinds of small intervention where early on you can say, hey, like, this is a really easy thing to navigate and move things in a different direction with children's behavioral, emotional, mental health, and parents, health needs. So I just hope we don't lose track of that. Like, I don't know the last time we looked at ACEs or whatever, but these are the kinds of things that get well in the way of reading proficiency and student success later on. This is like the most important conversation we can have, as far as I'm concerned, about where we make changes in student success and test scores and things like that.
Yeah, I really appreciate that line of thought, because I think what we're seeing in both the bright spots and the things that we need to pay attention to is we're seeing things that are inhibiting children's ability to come in and learn, whether it's their family is struggling for a range of different reasons. It could be that they don't have food, they are unhoused, they are transitioning into shelters, they are sleeping in cars, they are the parents are struggling. We've seen now cohorts of students transition through a COVID-19 pandemic with, again, families, mental health, and people struggling. So again, some of the things that we've been trying to remind folks to pay attention to is we're anticipating seeing increases in some of these things. We are now 5 years into having now data on what we expected. We are seeing kids and families struggle. And so what is our response, and how do we do that in a moment where funding and resources are really challenging, both at the federal and the state levels? So I appreciate this committee being open to hearing a little bit more about a collective vision for the work, because most of those things are impacting kids. They're also impacting educators, right? All right, next slide, Martha. So one of the other roles as a part of our monitoring work through Act 76 is that we were specifically used to monitor the impact of this legislation. So over the first year of Act 76, we ran a full process with partners across the state, including legislative leaders, to say, okay, we know the intent of this law. How do we know it? How would we measure the impact? How would we measure success? And so we, again, went through and defined and articulated what we needed to measure to know whether or not it was making an impact. And I think one thing that's really important for this group to know, if you weren't a part of that law as a whole, is that the legislature actually used this as a way to support government accountability. So they charged Building Bright Futures and the State Advisory Council as the accountability body directly within this piece of legislation, so that we are actually monitoring change over time and that we can course correct. So we're working really closely with the Child Development Division, a range of private and philanthropic partners, as well as national partners, to monitor this law. So just a very, very quick snapshot. And also a quick plug, on Monday, the 24th, we're doing a full session with the State Advisory Council on the current status and impact of Act 76 through early childhood grand rounds.
I can ask,
Yeah,
so just on the first bullet,
yeah.
capacity, did that meet expectations, given the infusion of money? And
Yeah, so two things that I would say about all of this data. I came in last year and said, please don't anyone expect to see an impact in year one, because we're not going to see that in any of our numbers, and I was wrong. So I think that what I will say is, I think we've seen tremendous progress, partially because the Child Development Division and the agency overall, despite the veto, immediately pivoted and said, okay, now this is what we're implementing, and we're going to do our absolute best to support this transition. So they've moved incredibly fast to support this effort with so many other partners, right? There are so many private partners who are building the state's capacity to do this work. So what I would say is that in terms of this capacity number and seeing an increase in infant slots, that's great news that we are seeing 170 new infant slots. Does it mean that we're meeting the current needs for infants and toddlers? No. Are we moving in that direction? Yes. So it's really important in this first year and a half to know that we have seen an increase in slots for some children. We've seen, for the first time since 2018, more programs open than close. So that's an important thing to know. We're still seeing programs close though. So how do we support them, and how do we support businesses opening? In terms of affordability, I think it's really important to know that we are seeing families have a significant impact, right? So this is just one example of 550 families who are at 175% of the federal poverty level no longer have a copay. Are we still hearing from families that this is a problem and that we might have a cliff and that we need to be thinking about who has access? Yes. But in terms of the intent so far, we're doing a great job.
And I've never heard good news stories like the ones I'm hearing out of what we did. I mean, like, for people I am acquaintances with to come up and say, like, we're saving $1,600 a week on childcare because of this system. Like, I've never seen us do something that monumental otherwise in the legislature.
And it's important because you're not going to hear all of those things without monitoring it.
The reason I asked the question about,
Yeah.
Let's Go Kids
Yes.
is anecdotally, there's 6,000 nonprofits in the state of Vermont. And I'm concerned about redundancies in funding. Because obviously that's one nonprofit for every 10 people or 11 people in Vermont. So, and I know everybody's looking for money to support their program. So, but we're seeing the results, to your point. And that's very encouraging.
We're seeing significant impacts when we've made significant investments. And I think what I would urge you is, if you're not going to monitor those investments, then you aren't going to hear as much about where you've seen progress or also what's not working. And that's really important too.
so do you advise on whether the approach was appropriate, given, we can throw money at a lot of things? Was there another path that could have improved results without the cash injection? Can we change regulation at the same time? Is part of your charter to look at whether the implementation or the act was was best designed.
Not necessarily to say, was this strand of investment the right one, but what is the impact of that investment? And one of the things that we are seeing right now is that if there's an underspend, what does that mean for some of these things, right? And I think that the next bullet speaks to this a little bit. We have to give the law and give the new program time to do its job. And so I've actually been surprised to see change this quickly. But we also know that there are so many more families who actually are eligible that aren't accessing the program just yet, right? So to answer your question more clearly, no, I don't advise on, is this the right mechanism to fund this, or what would that look like? We did provide guidance that without some sort of investment, we won't see as much of an impact. We actually need to inject and infuse certain funding source or a funding source to build capacity in this area. But our role is not to say, here's the right one or how much it costs, right? Because there are so many different ways that you can look at how to create change or an impact. So what we would come in and say is families don't have access to childcare. Here's what those rates are. And here are the 4 different things that we could think about. And here's the information you might need to make a decision on how much funding you want to invest in this area, and then allow you to ask questions about, okay, is it a payroll tax? Is it this? How do we navigate that?
I mean, and the conversations leading up to our childcare bill were businesses coming in. I mean, we had them in economic development saying, please tax us, figure this out, because we're trying to do it on our own. And it's not working. We're trying to do it without money. And instead, what that means, we're making people get master's degrees and then work for $30,000 a year. So everyone, I think at the time, or a really good majority of both chambers and most business leaders came to the conclusion that only a large injection of money would solve this problem. That would lead to these kinds of results.
Okay, so Senator Williams and I were in the center of that vortex in the health and welfare
Yep.
over the past 2 years.
Mhm.
Regulation's a whole other issue. So,
Mhm.
you know, when we pull the regulation lever, which increases the cost, and there's a net impact, I'm just wondering if we've ever stepped back and looked at, well, you know, should we have the levers we pulled, were they the appropriate levers? Does anybody ever do that analysis? That's what
Yeah,
that's where the
that's-
fundamental question.
Okay, that's a great segue, because I think one of the things that we are working both with the business community on, but also the Child Development Division and some of our national research partners like Child Trends and Stanford, is what are the key questions that you as legislators want us to be answering right now, so that as we are coming into the next 3 years to look at impact, what are those things? And a part of that is continuous quality improvement. Right? We can change course at different moments in time. What's working, what isn't, and where do we need to shift, whether it's in rulemaking or things that are coming from the federal government around childcare and CCDF funding right now. So even since we've passed this law, there have been changes that have come from the feds that are now needing to be implemented and that we are managing with the Child Development Division.
I think I recommended we hear from one of my professors from the Graduate School of Education at Harvard, David Deming, who teaches education inequality. But it helped me realize that there's a reason politically elected officials always talk about higher education as if you had money, let's get rid of higher education debt, because that helps individuals with their own income. But if you were to put the money anywhere, you know, we can show, like, there's just the most rich data available is on, if you put money into little kids, you've saved society. Like, you've changed every metric, you know, that there isn't. So that's, I think, what's always stymied us is we know this is where the money should go, and you can't learn how to be an early childhood educator without feeling like you should continually know more. But then you're never compensated for that level of impact that you have on society and on kids.
And I think that that's actually one of the questions and things that we're talking about. What is the next lever to pull, and what isn't working? Because we are talking about regulations, we're talking about career ladders, we're talking about the importance of early childhood educators and how to value their time. So I think that one of the things that I would say to you all is as you're looking at the laws, as you're looking at data that's telling you we're making a difference or we're not, what questions do you have? What research questions? What data do you need that we can help?
So what you were just talking about, that's when you invest the money in the younger kids, you're getting ahead of the problems. It's kind of like cell phones in schools.
Right.
A 16 and 17-year-olds, they're probably not gonna be able to be changed. But if we can come back into the early, which brings me to my next point is one of the issues we grappled with was pre-K. And there's two different systems. They've got the federal 10-hour a week, and we got the state program where the actual school districts are running it. Is there any need to have both systems? I know it's different funding, but whenever you take federal money, you've got different regulations that you have to abide by too. So we need more childcare for sure, but pre-care isn't necessarily childcare. I mean, it is, but.
It's as if you looked at my next slide.
Okay, no,
No, that's okay. I do want to talk about pre-K for
Okay.
a little bit, especially with this group, because we spend so much time in Senate Health and Welfare and in House Human Services and a range of different committees talking about the importance of high quality early learning experiences. And one of the things that I want you to know about pre-K, Martha, if you want to go to the next slide, thank you, is that after we spent extensive time talking with committees, where Act 76 landed in pre-K is the creation of a study committee, which was the Pre-Kindergarten Education Implementation Committee, PEIC. And before I tell you a little bit about that work, I would just name that the pre-K money that you were mentioning is actually state money. So it comes through the Ed Fund. So we're not looking at federal versus state dollars in these two programs. We're actually saying we as a state have invested in childcare and early childhood education. We've also invested in pre-kindergarten education. The way that we currently do that is by providing 10 hours a week of publicly funded pre-K for 3, 4, and 5-year-olds that are not yet enrolled in kindergarten. And we do that in public and private community-based centers. So they call that a mixed delivery setting, right? We have a lot of debate around mixed delivery and the importance and value. But there are so many different ways that we can educate young kids. So this committee was tasked with doing some of what the legislature couldn't, which is let us understand the current system of pre-K. And if we were going to change that model, what could it look like and how would we implement it? That work was incredibly challenging. I held a seat on that committee, but also represented families and brought in a significant amount of data to help support that committee with the work. There's not a lot of great data on universal pre-K. I'll show you some of that, and I've talked a little bit about that, but where that committee landed on pre-K was 4 key recommendations. And what I would say to you all is before the voting, there were 40 recommendations. There were timing constraints, and I'll talk a little bit about that in a couple of minutes, but where they landed is as we're thinking about changing the dynamic of pre-K and how we educate young kids, we need to maintain the benefit for 3-year-olds, because one of the things that had been proposed by the legislature was to remove the access to 3s. We need to expand, if we're going to expand, start with 4-year-olds. So move towards a full day for 4-year-olds, but maintain the benefit for 3s. The other thing that the report said is we need to know more about people waiting. We don't understand enough about what it actually costs to administer pre-K in these different models. And the same thing is true for community-based programs. So what does it really cost to educate? And what does that shift look like in terms of the number of hours and those pieces? Martha, will you go to the next slide really quick? Oh, sure.
I was just wondering if you needed a photo credit on that last slide. It looked like your daughter again.
Where are we?
Last slide.
The last one? Nope, it's not. But I will say, one of the things that I love about our reports and anything you see in our slides is these are Vermont kids. So we actually hold a series of events and have photo releases. So you're seeing Vermont babies. And if you have grandkids or kids that would like to be in your slides, this is how we use them. All right. So this next slide, here's what I will say about the PEIC that was incredibly strong. There was a facilitator that was brought in to do that work. The committee members were incredibly strong. They came to every meeting. They came to additional meetings to try and land this plane. They also collected data on behalf of the committee to bring additional information in. And they actually cared about data-driven decision, which is, again, we're seeing a movement in that area, which is great. And we brought in, partners across superintendents, pre-K coordinators, public and private pre-K teachers, principals to really say, okay, what do we know about the current system and how we would need to. The challenge with that committee is there was an incredibly unrealistic timeline for getting all of that work done. The legislature couldn't do it. And then 23 of us came into the room to try and do it in a year. And it was really challenging, but there was a lot of really great work done. And I think that one of the things that I would ask of this group is, as you're thinking about, again, addressing needs in the education system, there's so much data that we compiled here on the experiences of school districts, of school board members, of educators, that we've summarized for you in a range of ways. That's really important to think about as you're making broader K-12 decisions. How does pre-K fit? And really making sure that our youngest and most vulnerable kids are a part of that conversation. Because a lot of times what happens is we talk about K-12 and pre-K is an afterthought. And if you really want to think about the longitudinal nature of child outcomes, we have to be earlier on. Instead of talking to you all about the challenges of that group, I'd rather give you some data. So Martha, can you go to the next slide? Thank you. All right. Here's the data that we have on behalf of that committee that's really important for you to take a look at once you decide you want to move in a direction on pre-K and the system. There were 4 different surveys that were conducted. There was also a range of information gathering that happened across committees. So we have information from pre-K educators, principals, superintendents, and school boards. And these are the things that everyone wants you to know when you are making decisions about education reform. One is the infrastructure needs. Anything that you do right now is going to involve retrofitting classrooms, expanding transportation, deferred maintenance. I heard you talk a little bit about this with Beth, and I'm glad I heard the end of that conversation, right? It does involve actual physical infrastructure needs. It also means developing age-appropriate spaces. So if you're thinking about the expansion for 4-year-olds, what type of buildings, what type of bathrooms, playgrounds, all of those things are a piece that need to be considered. Heating and cooling systems. Another key theme is workforce. We are in a workforce crisis across every sector, right? Not just early childhood education, but early childhood educators, special education staff, support staff. And any changes you make are going to impact staff ratios. It's going to impact licensing and professional development needs. So how do we think about those? I'm not going to harp on 3-year-olds outside of to say a lot of feedback that we need to maintain early childhood education and pre-K for 3-year-olds. And that we need to think about developmental outcomes and also the challenges with delivering special education. In terms of regulatory oversight, we know that there are 2 different agencies and 2 different systems that are administering pre-K. That is challenging. And we have some new leadership. So how can we build current collaboration and what are the ways that we can streamline and have some more coordination? On the funding side of this, there's significant funding that is required across tech upgrades, staff time, needing people funding adjustments and strain on school budgets. So again, you've heard all of that, but just be thinking about how the funding for things like deferred maintenance and workforce are also coming into play there. I think one of the last things I would say on this pre-K information gathering that we did is that there were a lot of areas of agreement. Everyone agreed we should expand pre-K for 4-year-olds and that early childhood education, to your point about early experiences, that's the best and most important thing that we can do. So how do we invest in this area? So there was agreement on expansion. There was agreement on maintaining 3-year-olds, mixed delivery, and a high quality, well-educated workforce. And then there was agreement that we need data and infrastructure and systems capacity.
Can I just ask, maybe you said it, but what's like 1 or 2 of the key pieces of data that you wish you had statewide? I don't know, like,
It's a fair question. It's such a fair question. And one of the things that we actually did as part of that was bring everyone together and say, what data do we have on pre-K?
yeah.
And what are all of the data that we need?
Well, bless you for doing that. 'Cause many people don't get that far.
The challenge is we don't have a lot of that data. So what I wish we had is here are the total number of children across public and private programs across every school district in the state. And that we could map that to their outcome data and that we could follow and track them longitudinally so that we know when we have a child who received early childhood education in this setting and then went to pre-K, this is their impact and this is what their grade method reading is. So at any point in time, I'm happy to talk with the committee about the data that we need and the data we have. Martha, if you want to go to the next slide, I can tell you what we have right now. And what I would love from you all is to answer that question, not today, but what data do you need that you don't have that would help you decide how to make changes in the system? So if you're going to expand pre-K, whether it's in the governor's proposed model or a different way to expand pre-K, what do you need to know in order to make those decisions? What we know right now is, again, we have high rates of participation of 3s and 4s. We're seeing an overall increase over time. You definitely see the dip during COVID, right? So we're seeing that dip, but we're back up to pre-pandemic levels of children who are accessing pre-K. I think I would note again, we're ranked nationally in access for 3s and 4s, right? We've had some of the highest rates in the country, and we have them since 2017. One of the important things for you to know in terms of mixed delivery or where the kids are is that there's a range. Over 60% of the capacity for pre-K is in private community-based programs, not in public schools, right? So, and that varies across different parts of the state. So we can't just have one size fits all model for delivering pre-K because that will limit equitable access. So what does that mean? And so what that means again is like that 43% of those slots are available in school-based programs, 57 are in private or center-based programs. Any questions about those? All right, last indicator. Child outcomes. This is one of the things that the business community in particular asked us to pay really close attention to. And Martha, I'm going to have you stay on this slide for just one more second. Even though we've made significant investments, we can't expect to see an indicator change in 1 year. But what I can tell you right now is that on student outcomes, children who attended a pre-K program before entering kindergarten had higher rates of readiness for kindergarten, which is a great outcome. We also see a positive trend I had mentioned earlier in 4-year-olds who are meeting expectations in math and social emotional development. And we also know that 2 years of pre-K is better than 1 from our national indicators, just in terms of how we are thinking about their preparedness and readiness to learn once they enter kindergarten. Next slide, Martha. I just mentioned a little bit about how this varies across the state. We are a very rural state in terms of access, right? So I just want to name a couple of pieces for you. So first, in the northeast corner of the state, along the New Hampshire border, we are seeing that many children aren't able to attend the programs that families can reasonably access in those schools to attend kindergarten. So naming that we do have a cross-state access issue there. We also are seeing that most school-age children are attending elementary schools in New Hampshire in this area because there are tuition and enrollment agreements in place that support the ability to do that, but they don't apply to pre-K. So we have it for K-12, but not for pre-K. And so that's one of the challenges that families are facing. And what's happening because of that is that families are then having to pay full tuition for early care and education to New Hampshire programs just to access pre-K.
I asked for that to be drafted based on the folks that came in and told us that was their issue. Just FYI. I just thought, okay, I don't know what that looks like, but I'll show Ginny and Seth and have the language.
So as we progress with our education plan, and I want to share some information. We had a pre-K program in Benson, which had some kids from Madison County in it.
Yeah.
School supervisory union decided to move it Castleton, which is about 30 minutes from where it was. And because they they had the resources there, but Castleton had more. I don't know if it was a money issue or what, but we're not gonna be able to have a pre-K in every district necessarily.
Hmm.
So in every school, maybe not be able to have them. So how are we gonna do that? That's my question.
It's the right question to ask, and if we're gonna expand, right, to try to provide more access, what does that mean? And in what places, and where are we gonna see deserts for that, right? Like, where are we not gonna see equitable access? So I think it's important for us to think about and to know what the challenge in that area is.
Can I just ask procedurally, is there any change to how pre-K will be handled jurisdictionally this biennium? I can't. So it's mostly in health and welfare in terms of these kinds of policy.
We don't have anything for us.
Right. Well, I don't know if anybody has anything in front of them, but I think the child care bill originated over there, but stopped in education. So I don't know who knows the answer to this question.
Well, I got in between some of those,
That's right. You
Farm
do.
there, and they were real upset because some of the kids made, because of
Mhm,
transportation issues, they weren't gonna be able to go to school.
mhm.
The pre-K program, so.
So in this moment, there's no change to universal pre-K until somebody actually makes a formal law that says, here's how we're transitioning, right? So we haven't seen that change yet. And the questions for you all are, once you get into that conversation, what data do you need to know, right? And then you can call me and we will tell you what data we don't have on that. I'm just kidding. We do have some, but Martha, if you want to go to the next slide, just so that you,
Just so you know,
Oh, sorry.
I have a meeting at 3:30.
I will end in 3 minutes.
Okay.
Thank you. So these are the state advisory council's recommendations related to pre-K. So yes, there were recommendations that came to you all from that implementation committee. The state advisory council is coming to the legislature and the governor and saying, all right, yes, you need to maintain 3s and 4s in a mixed delivery model that focuses on developmental needs. The second is you need way better data on all of this. We need to be able to track where kids are, what they have access to, how many hours, because it's different across the state. Just because we pay for 10 hours a week doesn't mean that that's what children are receiving in all of the different areas and sectors. We actually need way more data. And so the agreement was that the Agency of Education, the Child Development Division, and Building Bright Futures need to create a new monitoring and evaluation protocol for this. So we are starting to do that work. It does need significant investments. So you're hearing that from the Agency of Education's plan, as well as some others. And the last thing I will let you know about is the question that you asked me earlier about what the line item was in the budget. So Martha, if you go to the last one. So we received a state allocation from the legislature, also from the administration. Our job is to statutorily monitor the system and provide that level of accountability and provide the data that folks need. And what we are asking of the legislature right now, and it's currently in the Appropriations Committee, is for an increase of $322,000 to our base allocation. So what that means is House Human Services has included it as high priority in their letter to the Appropriations Committee. It is now in appropriations. It will eventually come to you all. And from my perspective, when the legislature is saying you want to prioritize government accountability and actually knowing both whether or not we're making an impact, but also holding the administration accountable to meeting the needs of kids and families, having that data is really important.
What's your base appropriation?
My base appropriation is $771. And we currently have a $5 million budget. So the work that we do is both publicly, privately, and federally funded. So at all times, from my perspective, it's important to not have the state fund 50% or more of that work, because I think it's important that the administration doesn't control the vision or strategy. So at all times, we're really trying to make sure that the state is never funding over 50% of that work. This increase is still well below that 5%.
What was the governor's recommend?
The governor's recommend was to maintain the base at 771. And so we were asking for that increase of 322.
And what's the total cost of the administrative end of your what do you use in the field and what is used to administer, your
Yep,
pay,
so our-
your pay, your whole,
Our entire budget,
Yeah.
yeah. So I also am happy to send that bigger memo to you all that we've given to the money committees as well. But most of the money that I mentioned, that 5 million, is going out the door to programs. So about 2.8 million is going out the door. Our base budget is generally around 2.5 to 2.8 million dollars. So on an annual basis, I am doing development activities, and I say I because we don't have development staff. It's definitely myself and our directors. So we're raising over $1 million a year to do the work that we are legally required to do in state statute. So we're writing grants to fund that work that is not funded by the state.
So other grants, federal or some of them to nonprofit.
It can be
NGOs.
arranged. It's actually a very diverse mix. So at any given time, my budget is built based on 13 to 20 different funding sources.
Yes.
I didn't think we needed to go into it earlier when we were talking about Let's Grow Kids, but my understanding is they've been privately funded with a very time-bound mission to advance universal pre-K. So not only is there no overlap, but we've never tasked Let's Grow Kids with anything. Building Refuges is the state's partner in growing the programs that Let's Grow Kids encouraged us to create and fund.
It's that, and it's actually the accountability to say to the administration, hey, actually, you have a really big problem on insert housing, mental health, right? Or to you all to say, right, like, here are the things that you need to pay attention to, but also, again, it's that monitoring and accountability to say, what do you need? So our advisement was over 150 last year, whether it's to you all or to the administration. So we are seeing the increase in the need, which is great, and the funding doesn't meet that, and that's okay. Right, to an extent.
Yeah.
But it does jeopardize our ability to do the work. And given where we are with federal funding, again, 75% of my budget is federally funded right now.
Right. I think you're also the most visible front door to a parent or family trying to figure out, oh, I know there's this new money. What do I do? Most people don't know how to pick the phone until CC back. They reach out to their local Building Right Future leader.
There are so many different doors that a family can go to. And I think one thing that I love about our work is that we do have so many different partners. And when I say Building Right Futures, my staff is 17 to
That's
hold
kind of incredible because you feel like you're everywhere.
550 people, right? So our job
Yeah.
is to support 550 people coming together on a monthly basis across the state to
Mhm.
advise you all. But our staff is 17, and the money that we're asking for is actually to decrease staff and just maintain base staff.
Wow.
So when the federal money goes away, we're not asking you to replace the federal dollars. This is just for our base operating.
So is any of that, state money used to leverage federal funding as a match?
Yes, so we actually provide match for some of the federal dollars. We also work with the Child Development Division on those pieces.
So
I know
one thing
you
we
have-
are doing is collecting letters. So that we can write a committee letter, appropriations committee and so forth. So if you can send us a letter asking, explaining the increase,
Absolutely.
asking us to support it, we'll then look at everything that we can, and we'll make some.
And you've always been general fund.
Yes, so our money is routed through the Child Development Division's budget.
Okay.
Yep, so all of that can be. Thank you all so much. I know that's a lot.
Very much.
Excellent.
We probably got more time today.
Yeah.
Yeah, and let me know how I can help in other committees. Sure.
I think how there.
So if we can all stay for just a minute. What I'm thinking about for next week is the Tuesday that has unsuitable happening. We will walk through and then take Wednesday for a more general committee discussion, just set aside time for committee discussion about witnesses, direction, trying to organize something for us. But, so we can really begin to, witnesses was one thing, direction, that kind of thing. So just set aside, may have some on Tuesday, by the way, as well, and then really set aside the afternoon on Wednesday for that purpose. Then take it from there.
Are we anticipating getting something from the house that's large in the next week or two? Or no?
I don't know, I mean, I think the House may send something over,
They haven't voted anything.
they had a month or something, but we're
Okay.
kind of doing our work and see what we get, to see what. And, you know, no, thank you. And so, you know, and I've asked Beth to be thinking about helping us organize, you know, there are so many moving pieces, but if we just make it all one big ball, we're not going to get anything done. And so we're paralyzed with this spread, that bread. So I'm trying to really think about what we need to do first. I think is maps, figuring out the governance, and I know that the Senate Finance Committee is waiting for us to do that because so they can begin thinking about their work. And then there are all the pieces in the work. I think what we need to do is think about sequentially where how we attack those pieces, even though the whole time we know there's going to be. It is open in the end. So we'll be going back and forth and thinking about the maps, for instance. You know, what we're talking about actually, as it turns out, in the short run, I think is non-compliance for a little while until we have to get people in, take some testimony. And so, but let's just take some time on Wednesday and just have a general discussion about where we all are, what we're all thinking. And
Can I ask in advance scheduling ask because others may be
Yeah.
talking to folks in a related way. Students have been coming to me from different entities, you know, organized through different adult leaders, saying they want to come have a day to testify. And a lot of them have been following the various bills, are doing their best to understand them. So it's taken this long for them to feel comfortable. But I think what helps is they're students, so they need a day to come in and be prepared to have that conversation. And we need to invite different student organizations. They're circling around April 4th, Friday, April 4th. I would personally, from who I've heard from, try to invite, you know, students who have been working with the School Boards Association, the 15 students who are on school boards, who probably have some useful stuff to say. Linking learning to life. They're called something up for learning. I forget.
yeah,
Can we have a day where we invite young people to talk to us?
let's put that on our discussion for Wednesday.
Okay. Okay.
And, you know, there's other ways to get at students as well, because you might want to be thinking about from our individual districts that we want to have come and might want to think about various school sizes.
Right.
And that kind of thing. So let's just have the discussion.
I think since a Friday is probably the best time for young people to get permission to be here. I'm trying to nail the date down that we could all invite young people to speak to us for 3 to 5 minutes each, or however they want to organize it.
Okay.
Does that make sense? I mean, we just have to fashion it after pick a date for next Wednesday.
Yeah. Certainly, I mean, having some high school students testify could be great.
It was some of the most powerful testimony we got in Act 46. They did a mock debate on whether or not to pass Act 46, and you can ask Shap. It was the most powerful testimony we got. I would also ask, and I can ask next Wednesday, for a day for teachers, classroom teachers, to be heard.
Yeah, love to hear some classroom teachers. I did a little bit. That's why we got down to, I wanted to get down to principals. We had a couple of principals.
Right.
We wanted to do some site visits and we keep running into obstacles to get that done partially to do some of what you're talking about. Okay, well, let's be ready for a real, and I'll try to think about how to organize the discussion and in a way that we can make it be productive. And, so.
There are adults involved who might have.
Yeah, this is
great
good.
ideas.
By the way, just because I also have somebody did a photocopy of the same thing.
Thank you so much.
You could
Are you
use that.
around for 7 afterwards?
Yeah, there are educational leaders who'd probably be happy to help us organize how to make the students feel comfortable and productive if we pick a day and a time frame.
Okay. So with that, just know that we're going to take some time as kind of as much time as we need over the, what, now and then for committee time and really make sure we're heading all together in the same direction. So, okay, I think with that, anything else?